You're gonna see yourself for a second. Yeah. Anyway, she's papering an IRB for us because here's what's happened is I so hope you like this. I'm using AI to measure parts of the report automatically, and we're getting pretty good. We've got it from the ultrasound machine.
Yes.
The magic of the internet, an AI box measuring it, and it's spitting out into my recurrent report. Poorly, the decimal space is moved, and we're dialing in but it's working.
I always wondered how you could have 3 decimal point like specificity, like 3 thousandths, really.
I'm counting how many pixels between constraint bars.
Yeah.
And it does all the math. So is it 3 that I'm with you. Yeah, you're right. But I think I'm pretty good to within a tenth or a hundredth, but a thousandth.
Yeah.
Yeah, you're right. Like as it flexes it. Anyways. So if this were the new report for you, where do your eyes go?
Okay. First thing it looks at is that the green, yellow, red bar.
Yeah.
1.24, 0.82.
The values aren't hooked up or mean anything. So
okay. So that's where my eyes go. My eyes go to that largest plaque CIMT reading. The patients love the vascular age. That's the meaningful piece to the patient. So if I was going to design this report, I would have that pop out more than
vascular age.
Those other 2 readings.
And you have a lot of serial scanning.
I do a lot of serial scanning.
So I need to show it to you in a way that shows the trend.
Yes, please.
Trend. Awesome. The IMT number itself doesn't mean much to you or I mean, to you it does, but to patients, you want to see it in reference to something, correct?
Correct.
So this slider hooked up, it's going to be green until about 65, 70%. And then 75 plus are going to be red in the reds.
Okay.
You're cool with that?
I'm cool with that.
All right. One more. Not one. This is my problem. Everything I show in this report, I can't make a prediction. I can reference research studies and databases and but I want to give the impression that you want to give, I believe, of this is where you stand with heart attack and stroke. And I don't know where to find this in a reference table, but 0 to 10%, no plaque. 11 to 30, the disease has started. This is what I'm saying is the message I want to put out.
Okay.
What I'm asking you is, how would you cleverly rename this or?
Right. You're also going to you also want it to be concordant with the other numbers at the top, right? Like you don't want the slider bar to say your CIMT is 75%, but because there's no blockage of 0%, you don't want to give the false impression that there's no process started. You see what I'm saying?
Blockage. So I need to make sure that people know the distinction that there are 2 independent risk factors here.
Right.
And usually they correlate, but not always. So please respect them individually as risk factors.
Right. Exactly.
Please. Okay. Hey, would you use an ultrasound probe if I handed you one?
I don't know how. If I could be trained, I would.
If I gave you, in a few hours time, I could get it so you could get that picture of the IMT lined up. And that's all you're going to use it for is a screening tool. And then if you find plaque, then you would call my technicians in. I would charge you, this is all suppositional.
Right.
Like $500 a month, and you get to scan as many patients as you want and send them as many reports as you want. So you could do this quarterly if you wanted.
I see.
Do you like that plan, or do you like the technician coming? Or I'm looking at other options.
Okay. So Craig Bax is doing butterfly screening with his office. He says it's the greatest thing since sliced bread, and he does it everywhere he can. And he goes to health screening malls and does it in parking lots and wherever he can get a hold of a bunch of people, he'll scan.
He's pretty scrappy. Yeah.
that's not my style. And I mean, you know how many CIMTs I do a month. I do them all with you. So it's what, 7, 10, 12 maybe at the most on a busy month.
Hosting
But we don't
solid.
do a lot of them. So to have an ultrasound screening for me with my tiny concierge practice, because I only have 200 active patients,
Yeah.
it doesn't make sense financially to have a tool like that I would have to rent to screen, because I mean, sure, I would like to screen every new patient at their annual exam and at their.
Yeah. What if your MA did it as part of the blood pressure and weigh-in?
We're still talking, let's see, how many would that be? 6, 18 a week at the most. And that would be screening every single patient, my 20-year-olds, my.
Mm-hmm. But you would have that data on all of them and a video of it.
So
I'm not pushing. I'm really
understood.
18 a week. So you would view it as not worth it because
the volume is too low for a concierge practice.
Yeah.
Nice idea for a busier practice who's seeing 20 or 30 a day. Hell yeah.
Yeah, I think it would work better for Craig Bax, who is kind of swinging for the fence at any look. Like, man, doing that at that age is tough work.
Yeah.
Hats off.
Well, hey, I'm 60.
Well,
so.
You're not scanning in parking lots though. Like,
right.
Yeah, you've got a place where you like to reside and work and save lives. And well, what conferences are you doing this year, Doc?
I'm doing International College of Integrative Medicine. I'm doing American Academy of Oral Systemic Health. I'm doing Concierge Medicine Today.
Okay.
And I'm doing Hinman this year.
Really? You're getting in with the dentist?
Yeah, because I'm on the board of AOSH.
I love AOSH.
Brad Bale was on the board and he bailed and put me in his place. So I'm their like token medical doctor person on their board.
We've been talking about them lately, how they tell me how their cone beam, all x-rays, they could find so much more carotid and vascular disease if that wasn't coned out.
Oh, interesting.
And now we're talking about that with my tests. Like, do we report thyroid issues if the tech sees it? And do we even need space for it? Because that liability. These are crazy. I want to tell everybody, but it's going to kick up a bunch of work for you if I report every nodule.
Yeah, well, sub-centimeter nodules don't require an evaluation. They just require watching.
Correct.
But I want to know if they're there. So yes, I want my thyroid screened.
You want your thyroids, and they are in the notes, I believe.
When she finds them, and it's interesting because sometimes they're there and sometimes they're not.
Oh, so you think it could be, and I'm being totally honest, if she's in the mood. So I'll give her a talking to.
Right. So, I mean, I get it. It's, this is not a thyroid scan. It's incidentally noted. Yeah. So if she's not incidentally paying attention, it's not going to get reported. And I get that.
So I have a crew here at the office that measures the ultrasounds, right? Would it be worthwhile for me to do a training? Well, no, because they're not sure quite, unless the tech focuses it in the center of the screen. You're never really quite 100% sure, but no, it would not be worth the training for the lab workers.
I don't think so.
Okay.
But I do like her to report it if she finds it.
Concierge Medicine Day, AOSH. I do like that crew of dentists who are super passionate about College of Integrative Medicine. Is that about it?
Yeah, International College of Integrative Medicine. I think that's all. And then Mindshare. I'm going to Mindshare, but that's a whole separate. That's business development. That's not medical.
Oh yeah. Is that a pretty cool group?
Oh my God, it's so cool.
I've heard about them. I should read up on them. I might ping you back on that.
Actually, I should get you an invitation to come to Mindshare. So Mindshare is health entrepreneurs. And so if you're an expert in your field and you need people to know about what you do, it's how to get there. It's you decide what floats your boat, but they'll offer you how to write your book, and you'll kind of go on that track, and you go hear those lectures, or you want to be on TV, or you want to be on Dr. Oz, or you want to be a blogger, you want to be Instagram famous, then you can go to all these different. There's things like the campfire talk, how to set your brand, the brand, like how to create your narrow niche so that you're viewed as the expert in your industry, and then how to capitalize on that to get the most possible clients.
So business development question. What do you enjoy of that? Sorry, that's what you were saying.
Yeah. So for me, I've been doing this over 30 years, brick and mortar, one-on-one in the exam room. That's the most inefficient way to spread healthcare, one-on-one, face-to-face in the exam room.
Yeah.
Right. So I also would love to make some pajama money that I make when I'm in my pajamas at sleep at home. Right. And while a membership practice does that some, right? Because throughout COVID, I lost about $60,000 last year, but I didn't go bankrupt, right? I still had membership. My staff didn't get paid. Everybody got paid, and we moved to a new building all at the same time.
You upgraded?
So, yeah, we did. So I now have my own standalone house that I converted to an office. So it's, and I still love my one-on-one patient relationships. But as I swan into I turned 60 this year. So as I swan into the last decade or two of my career, I would like to work less and make more money. Right? So Mindshare is going to help me do that. I'm working now on creating my first marketing funnel to create email lists so that I can narrow my niche. So I've decided that I'm going to create the blood pressure blueprint, because I have integrative ways to help people control their blood pressure naturally, reduce their dependency on prescription medicine, and then subsequently prevent heart attack and stroke, kidney failure leading to dialysis. So that's the whole Bale-Bonine thing, but nobody Googles stroke prevention. Nobody Googles oral systemic health. Nobody Googles root cause resolution, right? They Google blood pressure. So I'm going to be the blood pressure blueprint, and I'm going to be Ellie Campbell, your favorite family physician who specializes in blood pressure.
Okay. I'm hoping this will knock your socks off. I'm glad you told me that. So at the bottom of this report, I'm going to be running ads.
Okay. Yeah.
Let me show you a version of it. So the first was, click here to talk to a doctor, Craig Bax. But there's no reason I can't hyper specialize and say, if your issue that you got this test that you're concerned about was blood pressure, I could link it right to you. Now, the laws about interstate and all that get a little goofy, but with COVID having just happened, Craig Bax is being a little risky. He's cautiously risky. Like, he's setting up other doctors in each area to meet.
Right.
Anyways, this is the future, right? I think.
Well, and also, so what the blood pressure blueprint is it's going to be an automated thing that really that's about me, but doesn't really include me. It's more like an online program for you to learn all the fundamentals of how to eat clean food and drink clean water and exercise and meditate and take your supplements, and these supplements do these things, and this is why you'd want to see a dentist, and this is how the dentist can help. So it's all automated. They're not getting a relationship with me as a doctor unless once they've been through the blood pressure blueprint, they want to become my patient.
So then they earn it, they lose the weight and they prove to you in some way that they're serious. Then
they can become my patient.
That is a
But
great way to qualify.
we still have the requirement. You have to come see me once, face to face, here in Georgia, at least one time.
Yeah.
And I have a membership based practice, so they join my membership, but that's 10 grand for the first 6 months. So
That's one of the
I'll
higher
take
ones
them.
I've heard of, Doc. That's pretty good. Hats off. You're worth it. That's so cool.
So
10 grand. And you got like 200.
And I mean, after 6 months, it drops to 258 a month. So yeah, just front load it because we do a lot of work at the beginning.
Yeah, if they're serious, front load it. Like let's commit you to getting your health in order.
Yeah.
Okay, so a thing at the end. You're not. I mean, I'm throwing out ideas. I know we're not committing each other to it, but you can see how. Oh, so here's the part that'll block your socks off. Sorry, I'm a little scattered. We are hiring a firm to do advertising to everyone that's Googled, my brother died of a heart attack or had a heart attack, and I'm concerned myself. What do I do? We want to, we think in big zip codes, there's enough of those people Googling, or you can find them through other markers to advertise and have them come to an office for us to scan them.
Got it.
Now, the first one we're going to do here at Vasal Labs. The second one, we're going to try to pick locations around the country, but if the first one works, which is going to be in about a month, I'll keep you updated. But I'm hoping this direct-to-consumer model would allow you and me to share patients, or I know who I think are the best docs around the country, and they happen to use my service, but they are in heart attack and stroke prevention, and they are tuned for that. Anyways, I wanted you to know about that because if I were to find super concierge, or how would you handle a volume of patients who are
so first of all, I don't come to the office on Tuesdays. So my office is available. I have 3 rooms available on Tuesdays. If you wanted, I believe that if I get 20, 30, 50 people off the street who want to come to my office and get scanned, there's going to be enough interest in that 1 or 2 of those will want to become my patients.
So it's a numbers game.
So if you wanted to come to my office and just you hire the tech, you're doing this direct to consumer, they're paying you. There's nothing that I'm involved in other than I'm letting you use the space.
Yeah.
I would entertain that as an option.
That is fascinating because we were thinking about renting like WeWork locations.
Right. You could do that too.
But I like your office because if we're going to brand this, we want a certain consistent feel. And hold on, I was looking up your office. I imagine you bought an office with like a cottage type look.
I did.
Did I guess that right?
It's a little farmhouse that we converted to an office.
910 Hawk Creek Road, right? I'm going to Zillow it right now. Kind of exciting. Like you've been reality to your will. You've got your office. You have a meaningful. I'm so happy for you, Doc. Like so few people figure this out. Is that presumptuous when I see stuff like that?
I have a fantastic staff of 5. The best thing I ever did for my practice was hire a nurse to be my scribe.
Oh.
So she's a certified health coach, so she can help patients implement every care plan that we start.
What's the benefit is she closes the loops that you start?
She closes every loop. She is a bulldog about closing loops.
That wraparound porch is beautiful.
Thank you.
The fountain, did you pick that out?
No, that was here actually. That's gone now. It was old and didn't work. And
what are you going to grow in that trellis?
I think the trellis maybe. I think that picture was taken from Zillow before we remodeled it.
Oh.
So we added 1,100 square feet, took out the trellis and the fountain, redid the wraparound porch to meet ADA requirements, added a handicapped ramp.
Uh-huh. That's beautiful. And the kitchen, the same size?
The kitchen is our break room, and it's a little smaller because it's combined with a little workstation that I do most of my work at, because my office with my desk and all my textbooks and stuff is upstairs, and I don't even go there every day. Sometimes I don't even go there in a whole week. I work on the main floor mostly.
Good for you. Good for you. It's people who kind of get ultimate control over their life, and it doesn't always feel like that, but you are in a place that you like with the people. That's happiness, Doc. It doesn't get any better. I'm happy for you.
It's happiness. It's good. My life is good. So show me this report. Do you have one that's serial? Do you have serial tracings?
No, we're just coming. Okay, so here's the bad news. The techs are getting new machines, and it's about 20% different on the IMT measurements. So
Okay.
we were going to try and figure out a way to cheat it, but we scrapped that whole idea and just fess up to you that we're upgrading technology. I'm sorry. I can't find a way around it, but
So I can't really compare apples to apples is what you're saying.
no, but the image is so much clearer. And
Okay.
we were doing a study with arteriosil, and I have a strong suspicion that, I mean, there were patients who had little 1.2, 1.5, 1.5, and then boom, 2.2 plaque, like doubled.
Right.
And I think the arteriosil, there's plaque we're not seeing, is what I'm saying. And that arteriosil helped calcify it and build. I'm sure that's what happened, because it happened on multiple patients.
Oh, really? Their plaque went up.
Their plaque went up, but it's kind of like a coronary calcium score. If you throw a patient on therapy, that may
calcify it.
Yeah.
Because I thought repairing the glycocalyx would soften the plaque.
I've never seen it demineralize.
Okay.
I've only ever seen plaques calcify and then shrink. I mean, I've seen some guys with chelation that's been kind of impressive, but it's not super reproducible. If you want to talk chelation, I got a guy, I'll have to remember his name, but he's a MV, he's a concierge doc somewhere. He's got some pretty decent science. But no, I don't know of any way to get rid of plaque.
Okay. So you don't see, even in the Bale-Donine patients, calcified plaque shrinking.
I mean, so slowly over time, maybe, but it's never been noticeable. I have some, if there's a soft pocket in there, it will condense and shrink a bit. But once it's a nugget, they do tend to pancake down quite a bit. But I mean, nobody really, you're so happy that you arrested it that you don't, I mean, people just kind of watch the IMT once the plaque is looking calcified.
Right. But the IMTs will shrink.
Yes. Yes. I know of no lower bound. As far as I know, that Niaspan study saying you get a 3% increase in LDL with no upper limit, as far as we know. I'm not aware of an upper limit, but I do know that I mean, once you get around 0.6, it's really tough to get it thinner than that.
Okay.
But that's my impression, and that's my legal.
Right. I'm just looking for your Gestalt impressions.
Yeah.
So I have started a bunch of people on arteriosil. We're probably due for their, in fact, staff meeting yesterday. I said, pull me a report of everybody that we started on arteriosil.
Yeah.
Because it's certainly time for their follow-up CIMTs. I want to see what it's done.
You're so organized.
Have you seen CIMTs go down on arteriosil?
Yes, definitely yes. All right, here's the story. This is arteriosil. They did see the natural alignment between us, so they did get. I'm telling you my financial interests. So they gave me a thing for when my technicians sell it, but this is why I'm selling it. I don't sell anything else or endorse anything else, but this has got my eye. Tom Blue himself got a like 10 or 20-year reduction in IMT. I scanned it myself. I know it myself. And that is the same effectiveness as I had seen with a obese patient who had bariatric surgery and quit smoking. Had the same drop as Tom Blue had, with changing nothing else except just the arteriosil. That's his story, is that he changed nothing else. But it was like 3, 4, 5, or 6 months later. And I don't recommend doing this more than once a year because it just doesn't move that fast. So I'm very impressed by it. I've got my staff is telling me to be cautious, and I am, but
I know Roberta Van Zant is really excited about arteriosil. So she showed us a whole bunch of cases of her CIMT reversals. She's a Bale-Donine doc, and
Yeah.
um,
Is she in Texas or?
I don't know where she is.
How crazy is that? You and I have friends all around the country and we don't know where they are.
Yeah,
Like it's a different way to conceptualize
I know, especially since Zoom. She just lives on the computer. I don't know where she lives.
Yeah.
Yeah, so for me, the serial readings are almost more important than the data point in time.
Yeah. Let me put a note right in this right now.
The blue neck at the bottom.
Yeah.
Why is that there? That's just showing me where my carotid artery is, in case I didn't remember.
Oh, where
the
Helen is she's hilarious. She's like, you'll be shocked at how dumb people are. Like she's so polite.
Right.
And then doctors start trading stories about mistakes patients have made. But we want 3 different stories, like what is an IMT, and we'll show a good one, a bad. Like we want to get patients
Right.
able to, that's what it's for. So this will be a digital report. We're assuming patients are going to see it mostly digitally, and the images will pop out. Oh, hopefully you think this is cool, because I think this is super cool. Instant.
So for whatever this is worth, I'm
Yes.
in a networking group at the Chamber of Commerce, and I was telling them about my Mindshare business development stuff and how I was creating this advertising campaign and trying to explain some of the things that I was doing. And I said, women take in information differently than men. And there was only one other woman in the group. The rest of them are all dudes. And all three of the guys all at one time says, pictures. I want pictures and cartoons. I don't need words. Show me pictures and cartoons.
Animate it for me.
So take that for what that's worth.
Yeah, I don't know why everyone is so trying to fight nature. I mean, let's just play to everybody's strengths. I think I'm with you. Pictures. Okay, so check this video out. This is of a sweep up and down an artery. And this all 4 quadrants are the same thing. The bottom right is what the AI is measuring. So that moment on the bottom right, that frame, I may be able to, on your report right here, kind of give you a pop out and give this black and white, like a silhouette. So the patient could understand that this silhouette is that. So when I hover over it with a mouse, it'll pop up. I'm trying to think of every clever way to communicate to the patient, this is where you stand.
Okay.
And this yellow will be a individual plaque.
Okay.
But the question, we'll come back to this. Artery block. How would you like to communicate to patient when things are serious? If you could make it up.
Well, I think your blue, yellow, orange isn't as definitive as yellow, red, and green, or green, yellow, and red. So that's one thing. I think the colors could be green, yellow, and red, because everybody kind of knows red is terrible.
Yeah.
Stop. Do not pass go. Get help immediately.
How about the ranges? When would you want a patient to be like, all right, I'm getting up there, or I'm on the board, so to speak?
So this is plaque. This is not.
This is blockage. Plaque. How much blockage the artery? Yeah, correct.
Yeah. So I would actually probably put 3 categories instead of 4.
Okay. What would they be?
With the comment that 0 is the best, but because even zero plaque in the face of CIMT still needs treatment, right? So a 0 artery blockage doesn't necessarily mean no disease.
Yeah.
So that's why I'd probably lump them all together. They don't need to see a vascular surgeon.
Are you saying you want a total score, like IMT and plaque combined? Because it feels
No.
Trying hard to keep them separate.
No, not at all. I'm saying that if their arteries are blocked, 0 to 30% their medical management.
Okay.
Right? They're check all your numbers, make sure you don't have sleep apnea, check for diabetes, all, that still has to happen even at 0% blockage.
Uh-huh.
So
Checklist still needs to be done.
So don't give them the carte blanche, no plaque, congrats, go about your business.
So if they have no plaque and their IMT is under 75th, you're pretty happy, and they have no major medical history, you're pretty confident they're okay?
Yeah. I mean, we still look at numbers, right? I still look at if they have elevated, I don't know, myeloperoxidase or LPPLA2, we're full court pressing. We're doing a dental evaluation. We're doing stuff. Even if their CAMT is beautiful.
Yeah. How often have you seen an IMT where you didn't trust it, or you were like, you know what, these blood markers are horrible, but what did you think and how did you interpret that?
I always tell people this is one data point in time, and we need to get more data points before we're sure. So we're going to do this again in a year, or maybe even 6 months if I had a high suspicion. If they were obese, hypertensive, diabetic, smoker, and had nothing, I would probably check them again in 6 months.
Yeah. Okay, the data point. How often does that happen where you're distrustful or?
Maybe 3 times the whole time I've worked with you.
Like, it feels like it's been 10 years.
Not a lot. I think I've only been doing Valdenine for 6 years, I think, maybe 7.
Let's solve this right now. I'm going into the books. I need to know how long we've been friends. Did we meet at a Valdenine?
Did I go to Valdenine?
We met at one. I think, is that where we met?
I think that's where we met. I think so.
And who's your crew? I mean, Craig's calling you. But like conference crew, that's what I'm asking. Like, you hang out with Tom?
Tom Blue? I wouldn't say Tom and I go to a bunch of the same conferences because he's one of the few people that advocates really hard for concierge medicine and integrative medicine together.
Uh-huh.
So I see Tom Blue at the concierge conferences. I see Tom Blue at the integrative conferences. And there's not a lot of us that do both.
Yeah.
Let's see, who would I hang out with? Dental hygienist a little bit.
Who's the super cool guy at AOSH? Lee Osler.
Yeah, so Lee is not in my circle, but I'm on the board now. So all the Mark Cannon and both Susan Estep, Susan Maples.
All right. I got to bring it up to my
team.
Chip
so
Whitney.
AOSH is in September in Atlanta this year. It's Collaboration Cures. It's with AAPMD and AOSH together in a co-conference.
Oh, that's a good group. Do you think we'll ever find a way to get dentists to work together well? You're kind of the exception, honestly.
Yes, I do. AOSH is proving it.
Excellent. And it seemed like the difference in systems, like the insurance system versus the that finding the middle point where they're happy to exchange patients seemed to be.
Do you work with Chip Whitney at all?
Yes. Yeah.
Okay. So this is another place where dentists and doctors can come together because Chip's just started doing this thing with Bredesen where they're getting dental certification for the RECODE program.
Uh-huh.
So they only have to do 16 hours of continuing education and they can get certified in Alzheimer's prevention as dentists. And part of that requires, it's basically Valdenine for the brain.
Yeah.
I mean, it's almost all the same protocols.
For dentists.
But it's called RECODE. So, so he wants every dentist to be getting peripath testing and cone beam CTs to look at airway size, as well as looking at the carotid ultrasounds. because we now see a direct correlation with those periodontal bacteria. Besides increasing risk of heart attack and stroke, fourfold increased risk of Alzheimer's disease.
What was the fold on heart attack and stroke?
The periodontal bacteria.
Yeah.
That's the Brad Bale and Amy Doneen paper that talked about periodontal bacteria increasing heart attack risk, 3 different mechanisms, changing elevating lipoprotein level, changing the stickiness
What was
of
the
the
statistic though?
I don't remember.
Okay. But fourfold for
Fourfold increase in Alzheimer's risk with
Alzheimer's.
certain periodontal bacteria.
Boom. All right, I got to do some more work at those groups. We're getting back into sales, but okay. So 3 groups on artery blockage percentage.
Yeah, I would just make 3: 0 to 30, 31 to 70, and then above 70.
Don't you feel like 23% is? I'm asking, can we leverage? You're over a minimal percent in the teens or 20s, and let them. And if I can show it to them on a silhouette, would that be compelling?
Well, it's always compelling. Any blockage is compelling, but you don't need. I don't treat a 0% blockage any different than a 15% blockage, any different than a 30% blockage. I treat risk factors in everybody. But when they're 30 to 70%, now we're getting a little bit different. Now we're really full court pressing. Now we're not just screening anymore. Now we're treating. We may even get a consult with a vascular surgeon just because.
Yeah.
It's all this, everybody 70 and over, they all go see the vascular surgeon. Always, every time.
30 to 70, you kick them out.
30 to 70, I'm, really, those are the people that go get a cardiac stress test. Those are the people that get, we're more aggressive with those people.
Yeah, for sure. All right. I like it. Doc, that's all. Thank you so much for your time.
You're welcome.
You're a rock. I'll let you know. I'm going to save this video for Vlad, and I think he's in Moldova, and he does updates based off of the. Anyways, appreciate your time, Doc.
You're welcome.
All right, see you next time.
See you soon. Bye.